Labiaplasty. Dressings. Typically none. Sutures. Sutures dissolve usually in about 2 weeks. Wound care. Twice daily sitz baths with betadine for 7 to 10 days. Then resume normal hygiene. Activity. Increases tolerated with no heavy exercise or lifting for 2 weeks. No sexual activity of any kind for at least 6 weeks or until cleared by your surgeon. Special instructions. No tampon use for 4 weeks. It may be useful to wear a panty liner for the first 2 weeks. Wound healing problems. Although unlikely, this would be characterized by prolonged swelling and pain and/or opening of incision lines. Please contact your surgeon if this occurs.